Hello, my name is Samantha Hamlin and I'm a senior in animal science and I'm going to be talking about breeding-induced endometritis. So an overview of what I'm going to be talking about today, I'm going to explain what endometritis is. I'm going to talk about the first study done on breeding-induced endometritis. Then I'm going to talk about the normal inflammatory response after breeding that goes on in the uterus, and then what happens in an abnormal inflammatory response. Then I will be talking about some factors that influence the breeding-induced endometritis. And then I will explain the endometrial health grade scale, and then end with my conclusion. So what is endometritis? Endometritis is an inflammation of the endometrium. It is usually a normal physiological reaction that happens after breeding. The inflammatory response happens to get rid of excess sperm and debris, and it should subside within 48 hours. But some mares develop the inflammatory response where they cannot reside the inflammation after 48 hours, and this becomes a common cause of infertility. Another word for a mare who has endometritis is a dirty mare. And there are three categories. There's acute infectious, chronic, and breeding-induced. And breeding-induced endometritis is what I will be talking about today. So breeding-induced endometritis is the most common category. It is the leading reproductive health concern in equine veterinary practice. Hughes and Loy did the first study on it in 1969. They were studying that reproductively sound mares have a natural resistance to infections from their uterine defense mechanism. So they challenged this with Streptococcus, and their study showed that there was a discrepancy in some mares in their ability to resolve the inflammation, and that they had developed an abnormal uterine defense mechanism. From this study, we showed that the breeding-induced endometritis resulted from uterine exposure to semen. So in a normal inflammatory response, it starts when the semen is deposited in the uterus to breed, and then excess spermatozoa are eliminated by inflammatory reactions, including PGF2 alpha, which also causes contractions in the uterus to get rid of the inflammatory products. Once these products are removed, the inflammation should subside within 48 hours. This response serves to clear the uterus of excess sperm and debris caused by breeding. Some mares, though, have an abnormal inflammatory response, and this happens when the endometritis persists more than 4 or 5 days after ovulation. If this happens, they become incompatible with the embryonic survival of their cells. Then these mares become susceptible and develop persistent endometritis. A study was shown that in 15% of brood mares, this inflammatory response process fails, and that causes a detrimental effect on fertility. So here I have a figure showing the sequence of events after breeding. In the yellow, those are reproductively sound mares, and in the pink, those are susceptible mares, mares that have persistent endometritis. So there are some factors that influence breeding-induced endometritis. Age is one factor that a study had found. Also, Henberg found that internal and external conformation of the reproductive organs was a factor. So if a mare had poor perineal conformation, and that means the vulva was sloped forward, they have a higher chance of endometritis before breeding than mares with good perineal conformation. Also, the position of the uterus in the abdominal cavity is a factor. LeBlanc found that mares with less success clearing the inflammation had pendulous or low-hanging uterus. And also Woodward and Troedson found that the condition of the uterus also affects the breeding-induced endometritis. So it is very important to identify and treat mares susceptible to endometritis in order to have a successful pregnancy. Susceptible mares are based on their poor reproductive history. They fail to clear inflammation within 96 hours after inoculation of bacteria or sperm, and also their endometrial pathology. So an endometrial health grade scale was developed to assess the endometrial health based on the quality of the glands and lymphatics, the fibrotic changes, and the infiltration of inflammatory cells. So in the top picture you see a grade 1 scale, a grade 1 cell. They are normal and healthy, and they have little to no inflammatory cells. On the bottom two pictures you see a grade 3 cell. They have dilated glands, layers of fibrotic cells, and there is some degeneration going on. This will impair the function of the uterus. So in conclusion, fluid accumulations is the most common sign of susceptibility, so you should always be checking on your mares for this sign. Paying attention to your mare and proper management of her will prevent this persistent endometritis, and knowing the signs and causes of breeding-induced endometritis will help improve reproductive efficiency. And here are my works cited.